Hello everyone, Dr. Mike here. Today we're something that we as healthcare professionals see, and it's crucial to have all the information. We'll cover the basics of what it is, the signs and symptoms, how it's diagnosed, and the typical treatment approaches. Knowledge is power, and understanding this condition can make a real difference. So let's get started. So, what exactly are we talking about when we say mouth and oropharyngeal cancer? Well, it refers to cancers that develop in the tissues of the mouth or the oropharynx, which is the area at the back of your mouth, including the soft part of the roof of your mouth, your tonsils, and the back of your tongue. These cancers can start in the cells lining these areas. Like many cancers, early detection is key. The earlier we catch it, the better the chances of successful treatment. We'll discuss symptoms in a bit, but remember, any unusual changes in your mouth that don't go away should be checked by a doctor. Now, let's talk about the signs and symptoms of mouth and oropharyngeal cancer. It's important to remember that these symptoms can also be caused by other, less serious conditions. However, it's always best to err on the side of caution and get checked out by a professional if you experience any of these. Some common symptoms include sores in your mouth that don't heal, white or red patches in your mouth, a lump in your mouth or neck, pain or difficulty swallowing, and even unexplained weight loss. Again, these symptoms don't automatically mean you have cancer, but they warrant a visit to your doctor or dentist for a proper evaluation. If you're experiencing any concerning symptoms, your doctor will want to perform a thorough examination of your mouth, throat, and neck. They'll feel for any lumps or abnormalities and may use a special light to get a better look at the tissues. If they suspect something more serious, they'll likely recommend a biopsy. This involves taking a small sample of cells from the suspicious area and examining them under a microscope for cancerous cells. Depending on the findings, further tests, such as imaging scans like CT scans or MRIs, might be needed to determine the extent of the cancer and if it has spread. The treatment for mouth and oropharyngeal cancer depends on several factors, including the stage of the cancer, its location, and your overall health. Common treatment options include surgery, radiation therapy, chemotherapy, or a combination of these. Surgery might involve removing the tumor and potentially some surrounding tissue. Radiation therapy uses high-energy rays to kill cancer cells, while chemotherapy uses drugs to kill cancer cells or stop them from growing. Your doctor will discuss the best treatment plan for your individual case, considering the potential benefits and side effects of each option. Mouth and oropharyngeal cancers are categorized by stages, types, and grades. The stage refers to the extent of the cancer, with stage 0 being very early and stage 4 being the most advanced. The type of cancer refers to the specific cells where the cancer originated, such as squamous cell carcinoma, which is the most common type. The grade describes how abnormal the cancer cells look under a microscope, with higher grades indicating more aggressive cancer. Understanding these classifications helps doctors determine the best course of treatment and predict prognosis. While the exact causes of mouth and oropharyngeal cancer are not always clear, several risk factors can increase your chances of developing these cancers. These include tobacco use in any form, excessive alcohol consumption, HPV infection, a weakened immune system, and a family history of these cancers. Clinical trials play a crucial role in advancing cancer treatment. They allow researchers to test new drugs, therapies, and prevention strategies. If you've been diagnosed with mouth or oropharyngeal cancer, ask your doctor about clinical trials that might be right for you. Understanding mouth and oropharyngeal cancer is the first step towards prevention and early detection. Remember, if you experience any unusual symptoms in your mouth that last longer than 2 weeks, don't hesitate to consult your doctor or dentist. Early diagnosis can significantly improve treatment outcomes. This video is for informational purposes only and should not be considered medical advice. Always consult with your healthcare provider for any health concerns or before making any decisions related to your health or treatment. Stay healthy and informed. Until next time.